Our patient is visiting this dental office for the first time. She is seated, her PPE is put on, and they are going to review her medical history. Syncope is defined as an abrupt loss of consciousness with a spontaneous recovery. It is usually caused by a cerebral loss of oxygen. Syncope can be triggered by stress and is most common medical emergency experienced in the dental office. There are 3 types: neurocardiac, non-cardiac, and cardiac syncope, with neurocardiac being the most common. Pre-syncope signs are pallor, pupil dilation, diaphoresis, goosebumps, weakness, dizziness, vertigo, nausea, elevated blood pressure, and pulse. Once the patient has lost consciousness, the patient will exhibit pallor, unconsciousness, and a weak, slow pulse. Remove any objects from the patient's mouth and place the patient in a supine position with the legs elevated. Loosen any tight clothing. Administer 4 to 6 liters of oxygen a minute. If the person remains unconscious, EMS should be contacted. Remember your repair acronym. Recognize signs and symptoms of presyncopal and syncopal patients. Elevate levels of consciousness. Position patient in supine position with feet elevated. Activate CABs of CPR, circulation, airway, breathing, pulse, and blood pressure. Implement appropriate emergency protocol. Loosen tight clothing. Administer oxygen 4 to 6 liters per minute. Monitor vitals. Keep patient supine until feeling well. Have emergency contact escort patient home. If patient remains unconscious, contact EMS. Refer patient if condition other than cardiogenic syncope is suspected. While reviewing the medical history, the clinician notices that the patient just had his appendix removed. She notices that the patient is not feeling well. The patient has a fever, increased cardiac output, tissue edema, pink warm skin, hypotension, anxiety, restlessness, tachycardia, and thirst. She recognizes these symptoms as shock. Shock is the condition produced when the cardiovascular pulmonary system fails to deliver enough oxygenated blood to the body tissues to support the metabolic needs of those tissues, and leads to abnormal cellular and tissue function. There are various types of shock: volemic shock, cardiogenic shock, distributive shock, and obstructive shock. She recognizes that he has a type of distributive shock, septic shock. The treatment for septic shock is positioning the patient supinely, contacting EMS, performing the CABs of CPR, monitor the vital signs, and administer oxygen 4 to 6 liters per minute. Treatment of the source of obstruction must be provided by a trained professional. A 22-year-old male patient is scheduled for his first periodontal debridement appointment. During reviewing his medical history, he informs the clinician that this is not an experience he enjoys and he has had unpleasant dental experiences in the past. The patient seems anxious and complains of being dizzy and lightheaded. The vital signs are taken and find them elevated, but still within normal range, so the clinician is going to begin the treatment. During the procedure, the patient begins to breathe rapidly and deeply. He cannot seem to catch his breath. He complains of a tingling feeling in his face, particularly around his mouth. His fingers are beginning to tense and curl. His skin is pale and moist and cool. His sudden onset of tachypnea and a feeling of suffocation are common symptoms of hyperventilation. Hyperventilation is a condition in which the patient breathes faster and or deeper than the metabolic needs of the body, thus eliminating more carbon dioxide than is being produced, causing a lack of carbon dioxide in the arterial blood system called hypocapnia, which results in an increase in the pH of circulating blood or respiratory alkalosis. The treatment of hyperventilation is to stop all procedures and remove everything from the oral cavity. The clinician places the patient in an upright position. She also needs to maintain calm and work with the patient to slow the breathing down. Loosen tight clothing around the neck region. To work with the patient to slow the breathing down, she can ask the patient to count to 10 in one breath and to breathe through his nose or to breathe into his cupped hands. While working with the patient, the vital signs, respiratory rate, pulse, and blood pressure should be monitored. For this situation, oxygen administration or paper bag are not recommended. Refer to the appropriate healthcare professional if condition does not approve. May need to be transported to emergency room for administration of other anti-anxiety drugs, such as benzodiazepine, or referral to psychiatric counseling may be required.